afternoon, everyone. Topic. Good afternoon, everyone. My topic is on evaluation of central corneal thickness in children using contact and non-contact techniques. Corneal pachymetry plays a major role in glaucoma risk assessment. A thin or thick cornea can either underestimate or overestimate IOP, leading to misdiagnosis of glaucoma. Although congenital glaucoma is rare, children can still develop steroid-induced glaucoma when treated long-term with steroids for various ocular conditions. So it is essential to have a normative data of central corneal thickness in children such that the improper treatment of glaucoma based only on IOP values can be avoided. Aim of our study is to compare the central corneal thickness measured by ultrasound pachymetry with that of non-contact tonopachy in South Indian children with and without refractive error. This study is an observational cross-sectional study conducted at our tertiary eye care center between August 2016 to August 2018. Children who presented to the pediatric eye clinic were screened and recruited. This study was approved by our institution's ethics committee. Coming to the inclusion criteria, children aged between 7 to 15 years who are normal without any ocular pathology or refractive error, and children with different ranges of refractive error were included in this study. Children with ocular conditions like corneal structural abnormalities, cataract, history of contact lens usage, glaucoma, history of ocular surgeries in the past, and usage of steroids within 3 months of enrollment to the study were excluded. The recruited children underwent a complete ophthalmic evaluation, which includes a baseline slit lamp examination, followed by axial length measurement with IOL master, and then the CCT measurement with tonopachy, which is a non-contact technique, followed by ultrasound pachymetry, which is contact procedure, by masked observers. Later, the needed children underwent cycloplegic refraction, and the dilated fundus examination for all the children concluded their ophthalmic evaluation. In tonopachy, automatically averaged 3 CCT readings are displayed along with IOP readings, whereas in ultrasound pachymetry, averaged 5 CCT readings are displayed. Coming to results and analysis, a total of 95 children and 123 children with refractive error were included in this study, and their right eyes were analyzed. Bland Altman analysis was performed to assess the agreement between the two instruments. On measuring the central corneal thickness using tonopachy and ultrasound pachymetry, the difference in mean CCT showed no significant p-value within the normal group and within the refractive error group. Also, no significant difference in the mean CCT was observed between both the normal and refractive error group when measured by these instruments. On comparing the central corneal thickness between the male and female, the male children have found to have thicker corneas than female children in normal group, but similar results were not obtained within the refractive error group. On further subgrouping, no significant difference in the CCT was assessed between the different age groups as well as between the different ranges of refractive error. The intra-class correlation coefficient shows excellent agreement between the tonopachy and the ultrasound pachymetry, with an average measure of consistency of 0.98 with 95% confidence interval. Studies have shown that 30 to 60% of ocular hypertension and normal tension glaucoma patients are misclassified and improperly treated when corneal thickness significantly deviates from the normative data. About 20% of glaucoma suspect patients had significant IOP adjustment once CCT was considered. Our study results were very much incomparable with that of Yang Ma et al., who analyzed 6.4 Chinese children of age 7 to 15 years. There are no previous studies done in South Indian children to measure the central corneal thickness in normal children. In our study, the thicker cornea in male children was observed, which was in agreement with the pediatric eye disease investigator group study. Prasad et al. And Ors et al. Reported variable progressive changes of CCT for different age groups, but similar results were not obtained in our study as we have not included children less than 7 years of age. One of the major strengths of our study is the larger sample size studied, comparing the contact and non-contact techniques for central corneal thickness measurement. It compares between the normal and refractive error group children. However, we have limitations. Children less than 7 years of age were not studied, and our study is not powered enough to assess the difference in CCT between different ranges of refractive error. Our study had concluded the mean CCT in children aged between 7 to 15 years was found to be similar with that of adults, and non-contact tonopachy can be used as a screening tool for CCT in children. Thank you.
Thank you very much.